Hello everyone, I'm Dr. Klein with Rimrock Wellness Center. I want to thank you for investing in yourself with this course. What we'll be going over is some of the very basic things, and these basic things doesn't mean they're easy, it's just the basic things, the most things that people miss. How to breathe better, how to bend better. And these are the things that are going to help strengthen your spine, help you avoid injury, and help you actually lessen your time here at the chiropractor. And we want you to keep coming in because that helps release torsion and keep your immune system working well. But the problem is we have so much chronic instability in our backs because of how we move. And a lot of it isn't our fault. It's our culture with flat surfaces and wearing shoes and the sedentary lifestyle. We've kind of forgotten how to move. So this is retraining. It's unlearning the lies. And that's the trickiest thing, is to unlearn what we have learned about movement. And then reapplying to these things you already like to do. And that'll help you actually feel better after certain activities that maybe you feel worse after. So a lot of the patients we're seeing, it's 80 to 90% of them, it's a muscular issue. It's not that they've experienced some sort of trauma where the bone is out of place and needs to be put back in. The joints and the ligamentous structure is being damaged by the imbalance in the muscular structure. And that can happen even if you're somebody who moves a lot, does a lot of exercise, CrossFit, that type of stuff, can still suffer from these imbalances. It's not movement that is the fix, it is how we are moving. It's not what we do, it's how we do it. So we're refining these basic elements to help these things work for you so they're not working against you, that they're not destroying your joints behind the scenes. And a lot of times we don't feel pain in the spine. We get it elsewhere. We get in our foot and our knee. But this is all just symptoms of a central structural issue that we need to fix. So that's our goal with this, is to help give you a strong foundation for the rest of your exercise. So the point of this course is to refine the basics. Even if you're a gold medal Olympian or you don't even know where your local gym is, the idea is that we do a lot of things every day. Breathing and bending, most things that are most common, and we just need to strengthen those two to really help exercises work for us. So if we're not approaching exercises with the right basics, we might not get the results we want. So we want you to actually improve with the things that you're working on, the exercises, but even daily life, like things like gardening or just running around and playing, should make us better and not make us feel worse. And I understand this, because when I was in a lot of injury and pain, even with a good understanding of what biomechanics were, I was still a chiropractor, I had a lot of pain. And I'd think, well, I want to go play ultimate frisbee, just for like an hour. But I know that even if I did that, running around, all that pivoting and movement would make my ankles swell up, give me back pain. That would last almost all week. And then I'd have to decide next week if I wanted to go through that again. And that's not how it should be. It should be that movement actually makes us stronger and better, makes us feel better. And that's the way it was when we were kids, and we've kind of lost that. And it's not that we're older, it's just because we've given injury time to make us worse. So when it comes to breathing, there's accessory muscles. And we talk about accessory muscles like the traps and the SCM and the scalenes and the pec minor that kind of compress us because we overuse them to breathe. But there's good accessory muscles that we don't tap into a lot. And those are the serratus muscle. There's 3 different pairs of those. One we have here up at the top, attaching from the lower neck down into the thoracics, into the ribs, attaching from the lower cervical down in the thoracic to the ribs, helps pull the rib cage up when we breathe. And then the serratus inferior helps pull the ribs down. So these are the serratus posterior muscles. And then we have a serratus anterior. So the anterior attaches to the medial portion of the scapula here, and it's okay if you don't remember these names, just kind of giving the idea of what they do. Attaches to the medial scapula, and then from T1 rib down to T8. So all these muscles help expand the rib cage. The other muscle that we're missing, that's kind of at the core or the foundation of this, if you will, is the pelvic floor. And the pelvic floor is a diaphragm. So it sits here and it helps anchor us, pull us in. So when we take that big breath, we'll actually feel it into our sacrum bone. And that's this bone down here, which is the keystone of your spine. So you should feel a breath all the way down here to the sacrum. And that's that pumping mechanism. The sacrum to the skull, cerebral spinal fluid pumping up and down, we get a good breath. Really great for the immune system, but also good for the discs and the nerves. If you take a breath and you feel like your shoulders raise, or you don't feel the breath down to the sacrum, you're probably using the wrong accessory muscles. These are the muscles that I would propose to you we should be using more often. The pelvic floor is a foundation, and the 3 pairs of serratus muscles to help expand the rib cage. So that's decompression, anchoring at the same time. 2 elements that we'll be talking about. Because if we don't have those, every time we go to bend, we're going to use the rounding and motion of the spine and actually not use our hips. So the hips are going to come into play a lot with the pelvic floor, helping to bring strength and stability to that, but also lengthening the spine and decompression. So everything is kind of one thing all happening at once, where we have to take these different pieces and put them together to get it where we want it to be. One way that we know that we're not getting the right type of breaths is when we'll feel your spine. As chiropractors, we're feeling in this little groove here. That's where your ribs come in to attach to the spine. There should be a lot of muscle here, little canals of muscle. These are called the transversal spinalis muscles. The big one here is the multifidus, and they just kind of wrap all the way down. They're little tiny muscles just like shown here, but they're encase the whole spine, the sacrum. And those are the muscles that we can really strengthen if we have any arthritis or degeneration in the spine. And how we do that is the breathing techniques that we're going to be going over. So the problem that we have with hinging at the hips is they're just not anchored, they're not placed properly. Because of so many flat surfaces, all the comforts that we have in our life, sitting, sedentary lifestyle, not actually using our feet, our foundation, our hips become kind of externally rotated, and it shoves the pelvis forward. And the problem with that is these piriformis muscles, their obturator internus, which a lot of the pelvic floor muscles attach to, all that changes, and it changes the biomechanics. So the pelvic floor becomes a weaker structure. You think about the hips kind of shifting forward and the shoulders now behind it, like we see so many in the population. That pelvic floor, being a foundation, cannot support the rest of the spine. So it becomes weaker over time because it's not underneath. Everything's not stacked as it should be to help lift up against the spine. So a lot of time people laying on the table feeling these either kind of a weakness in the spine, or actually later on, if we keep letting that go, it's going to become that degenerative arthritis feel where it's really rigid and just compressed. Even somebody who's really active and moving a lot can have these problems. So we can have someone who's a triathlon person, really well-rounded, knows how to move, in quotations, and somebody who just sits all day at a desk job sharing the same degenerative patterns, and that shouldn't be right. Movement should make us stronger and better, but it has to be the right type of movement, and there's no special exercise here. It's just refining what we already do a lot of. A lot of breathing, a lot of bending. These are the motions we do most of the day. Even if sitting can become a great therapeutic exercise if we do it right, if we get this foundation where it needs to be.